Have you ever wondered if smoking automatically disqualifies you from getting dental implants? Maybe you've lost a tooth and you're considering implants, but you're also a smoker. Perhaps you've heard conflicting opinions. Some people say implants are impossible for smokers. Others claim it doesn't matter at all. So what's the truth? Can smokers get dental implants? The short answer is yes, but there's a very important catch. Today, we'll uncover exactly how smoking affects dental implants, what the risks really are, and what smokers can do to dramatically improve their chances of implant success. Let's get started. Before discussing smoking, let's quickly understand what a dental implant actually is. A dental implant is a small titanium post that is surgically placed into the jawbone to replace the root of a missing tooth. Over time, the implant fuses with the surrounding bone through a process called osseointegration. Think of it like this. When a tree is planted, its roots need time to grow into the soil and become stable. Similarly, an implant needs time to bond with the bone before it can support a crown, bridge, or denture. This fusion process is what makes implants so strong and long-lasting. In healthy patients, dental implant success rates often exceed 95%. But certain factors can reduce these success rates, and smoking is one of the biggest. So why does smoking affect implants? The answer lies in how smoking impacts your body's healing ability. Cigarettes contain thousands of chemicals, including nicotine, carbon monoxide, and toxic substances that affect blood circulation. Nicotine causes blood vessels to constrict. When blood vessels become narrower, less oxygen and fewer nutrients reach the surgical site, and that's a major problem. After implant surgery, your body needs a healthy blood supply to heal the tissues and build new bone around the implant. Smoking interferes with this process. Imagine trying to build a house while constantly cutting off the delivery of construction materials. The workers may still try to build, but progress becomes slower and less reliable. That's essentially what smoking does to implant healing. In addition to reducing blood flow, smoking can delay wound healing, increase inflammation, increase bacterial growth, reduce immune system effectiveness, increase the risk of infection. All these factors make it harder for the implant to integrate properly with the jawbone.
Here's the important part. Smoking does not automatically mean you cannot receive dental implants. Many smokers successfully receive implants every year. However, the risks are significantly higher compared to non-smokers. Research consistently shows that implant failure rates are higher among smokers. In other words, a smoker can absolutely get an implant, but the implant has a greater chance of complications during healing and over the long term. Think of smoking as increasing the difficulty level. The procedure can still succeed, but the margin for error becomes smaller. This is why dentists carefully evaluate each smoker individually, rather than simply saying yes or no. Does the number of cigarettes matter? Yes, the amount you smoke can make a difference. Generally speaking, heavier smokers face greater risks. Someone who smokes a pack or more per day usually has a higher risk of implant complications than someone who smokes occasionally. However, it's important to understand that there is no completely safe smoking level when it comes to implant healing. Even light smoking can negatively affect blood circulation and tissue repair. So, while smoking less is better than smoking more, the safest option remains not smoking at all during the implant process.
Now for the good news. There are several things smokers can do to dramatically improve implant outcomes. First, consider quitting smoking entirely. This is the most effective strategy. Even temporary smoking cessation around the time of surgery can be beneficial. Many dentists recommend stopping smoking before implant placement and avoiding smoking during the healing period. Second, maintain excellent oral hygiene. Brush thoroughly. Clean between teeth daily. Follow your dentist's instructions carefully. Third, attend all follow-up appointments. Regular checkups allow your dentist to identify problems before they become serious. Fourth, control other risk factors. Conditions such as uncontrolled diabetes, poor oral hygiene, and untreated gum disease can further increase implant risks. The healthier your mouth and body are, the better your chances of implant success. Finally, be honest with your dentist. Some patients underestimate or hide their smoking habits, but accurate information helps your dentist create the safest treatment plan possible.
So, can smokers get dental implants? Absolutely, but smoking makes implant treatment more challenging. It reduces blood flow, slows healing, increases infection risk, and raises the chances of implant failure. The good news is that many smokers still achieve successful long-term implant results, especially when they reduce or stop smoking, maintain excellent oral hygiene, and follow professional guidance. If you're a smoker considering dental implants, don't assume you're automatically disqualified. Talk to your dentist, get a proper evaluation, and learn how to maximize your chances of success. Because the best decisions are always based on facts, not myths. If you found this video helpful, don't forget to like, subscribe, and turn on notifications for more evidence-based dental content. See you in the next video.